I'm excited to announce Dr. Kylie Meyer as an assistant professor of the School of Nursing at Case Western Reserve University. Dr. Meyer is a social gerontologist whose research explores programs and resources that help family caregivers support loved ones with chronic and disabling conditions, including Alzheimer's and dementia-related diseases. Dr. Meyer's interventions address multiple caregiving challenges, including healthy caregiving relationships, confidence with complex care, and caregiver financial well-being. Dr. Meyer, thank you so much for joining us. We are excited to learn from your research program today and your findings. As soon as you're ready to turn it over, the floor is yours.
Very good. Thank you so much for having me here today. While I pull my slides up, I want to share that I lived in Texas, even though Case Western is in Cleveland. I was at UT Health San Antonio, and my in-laws are still there. In fact, my father-in-law is living with dementia, and my mother-in-law is a caregiver. So I feel like I'm one of the team, so to speak. Today I'm going to be talking about today's topic, of course, models of care for aging populations, but I'm taking my own twist on it. As you heard from my background, I'm more focused on the family caregivers oftentimes, even though I'm a gerontologist. And I'm hoping that I can convince you that there's good reason when we're talking about models of care to be thinking about the caregiver. Oftentimes we think about person-centered care when we think about really good care for older adults. But of course, we want to expand that to person and family-centered care, reflecting kind of our interdependent relationships in late life. So I'm going to kind of go through briefly kind of the social and policy context, things that a lot of you already know based on all the organizations I see coming through in the chat. We'll talk about some of the challenges caregivers have with accessing resources and some navigation issues, and then some promising approaches that I want to share with you, many of which you may already know about. So I don't think I'm shocking anybody when I share that there's a growing number of family caregivers in the US, right? So these are some figures from the National Alliance on Caregiving. They did a study in 2015 where they found about 40 million Americans were family caregivers. And then in 2025, their most recent report, that shot up to almost 60 million family caregivers in the US. This is to people who are over the age of 18, but of course, that increase is really driven by the aging population we know, things like medical innovations, public health innovations that allow somebody who maybe in the past maybe experienced a stroke, for example, and would have passed away, but now they're living, they're surviving that health event and they're living, but they might have a disability. They might need some caregiving. So that's what we're talking about here. But there's also some policy contexts that have really changed what caregiving has looked like in our country. So this is a chart that looks at funding from Medicaid, which is a public health insurance for people who are low income, or maybe they started middle income, but they spent down to become low income and eligible for Medicaid. And in the past, we saw that a lot of that money from Medicaid was going to institutional care, going to nursing home care. And what we've seen over time is that it shifted, that those dollars are going to more home and community-based care, chore services, transportation services, for example. And this is a good thing, right? There's always going to be some need for nursing homes, but most people, when you ask them, they want to age in their community. I know I do. So this is a good thing, but it also means that the caregiver is often much more involved. A lot of these home and community-based services assessments really rely on a family caregiver to have some level of involvement to assist with maybe some of the transportation to appointments, for example. Last chart, I promise I'm not going to drown you all in data, but I think this is important context to think about when we think about these systems. So we do actually have a great program to support family caregivers, the National Family Caregiver Support Program. This passed in the year 2000, so it's about 26 years old, and it offers funding for things like respite care, counseling, low-cost legal aid, information and training, and information and referral for caregivers. And that's all great. And it's distributed through the area agencies on aging throughout the country. And I saw a lot of folks from the AAAs here. So thank you for everything that you do. And so we do see on the left side of the chart that we've had an increase in dollars towards the Older Americans Act, through which the National Family Caregiver Support Program is provided. That's good news, right? The problem is we've had an even bigger increase in the number of older adults. So per capita, there's actually been a 3% decrease in Older Americans Act funding and that support for our family caregivers. So That brings us to why is it so darn hard to get support as a family caregiver? You're doing really important work, really valuable work. Well, we know, of course, we just touched on one. There's not enough dollars to go around. That means longer wait list when we have these services. But there's a little bit more to it than that, right? So, the very first research study I ever did, it was actually in England, but there's a lot of overlap with the US. I asked caregivers about their experiences accessing information and support. And they gave me this really, really illustrative kind of language. They said, it's a maze. It's like hitting a brick wall. It's like this dance that I do. And like, tango is not like dance is fun, but tango is not how you want to describe your relationship with a social service provider. You want it to be simple. So that's not a good sign. And there's a couple of reasons why we think this is. Our caregiver supports in this country are patchwork. And it goes back to some of the funding, right? So when you have unreliable funding, that means, hey, we have funding one year. We can expand our eligibility criteria. It's restricted this year. We got to cut back and reduce our eligibility, or we have to get rid of this program, or maybe an organization has to close its doors. So it's not as reliable, and that makes referral hard. That makes information finding hard. The other piece, and I think John might be going into this a little bit more in depth, so I'll trust the expert on this, is that we have this discrepancy in how we pay for things, right? So you might have a disability that is it's because of a health condition, and so you have a transportation need, but your health care doesn't always pay for the transportation need, right? So we have this need. We think about ourselves, understandably, as an entire person, but our payment models don't always recognize that. So we need more integrated care, and that can discourage the types of care and resource finding that we would like. The other thing we know is that finding information is actually a skill that you learn over time. This data is from a study that we recently completed enrollment on. And we asked these caregivers, they were caring for people living with dementia. We said, how sure or confident are you that you can find resources in the community that can help you take care of yourself and your care partner? And overall, we do see most people are in this kind of 9, 10 category, 10 meaning totally confident, and all the way over here, 1 is not confident at all. So that's good, overall confident, but we do see this long tail. There's a lot of people who aren't so confident. And even the 7, I get worried about the 7. Like if you're driving, you're going on a road trip with a friend, and you say, how confident are you with driving? And they say, oh, about a 7. You're like, okay, get out of the driver's seat. I'm going, right? So, I think we should actually still be concerned about this. So, a couple other reasons why it's so hard to find information and resources as a caregiver. Caregiver needs are always evolving. There's no point in a caregiving journey where you say, I know it all. I'm good to go. No need to study anymore. These, as a care recipient's needs change, so maybe there's a broken hip or a new diagnosis, the caregiving informational needs, the service needs in that dyad are going to change. The other thing is a lot of family caregivers don't call themselves caregivers. I call them caregivers. You might call them caregivers, but the wife caring for her husband says, I'm the wife. That's caring is a part of what I signed up for, whatever the relationship is. And yet that term sometimes is the key to unlocking the door to information and services, whether it's Googling, whether it's talking to a healthcare provider. Last point is here that help seeking again is that skill that develops over time, and you just don't know what you don't know. So if you're a caregiver, a brand new caregiver, you're calling up your area agency on aging for the first time, hopefully that agency is skilled at understanding this, right? But you might not be ready to express or able to express what your needs are, what the terminology you should use, what you could get help with from this agency. You just got a phone number, right? The other thing is sometimes this is a very like emotional process. Yes, there's finding information and resources, and that's all good. But some caregivers just want to take things one thing at a time. Some caregivers are like, tell me everything. What's going to happen like 5 years out, 10 years out? They want the whole story. Other caregivers are like, whoa, I can't do that. That's too overwhelming. So we need to find tailored ways to support the service needs and the information needs of caregivers. adding to this complexity is, of course, we have new technology, ways to deliver services with technology. And not that that's brand new. We've been doing web-based services for caregivers for at least 15 years. And that's great. We're seeing kind of this evolution, just like all sorts of sectors with AI. And we really do need to figure out what the balance is. So, how much do you need a human in the loop versus how much can you rely on AI? We just wrapped up a project where we introduced a AI assistant to provide financial information to caregivers. And so that was kind of interesting. What we found is that about a third of caregivers use this chatbot when offered to them for free. But a lot of those text messages were not because they could text the AI through their phones. But a lot of those conversations were like, hello, where's the Zoom link? They thought they were talking to the facilitator, the human being who was facilitating this program. So we have a ways to go in terms of training family caregivers. But I also want to recognize some caregivers will never want this resource, and that should be perfectly okay, right? So that brings us to now that we've described all the problems, right? I don't want to be a Debbie Downer. Here we're going to get more hopeful, right? So, promising models of care. So, I want to talk about the California Caregiver Resource Centers. They have been around since 1984, but they are still such a good model. These resource centers there's 11 of them throughout the state of California, and they serve about 6,000 family caregivers per year. And in fact, a lot of the things that they have done have become models for the area agencies on aging nationally. And so they, of course, offer those services we mentioned earlier through the 3E programs, right? Respite care, education and training, all those National Family Caregiver Support Center services, because that's where a lot of their funding come from. But they also have other funding, such as from the state. The state of California puts in investment from their general fund. They have local grants and resources. One of the things that they do that I really want to highlight is they assess their caregivers every 6 months or so. So that means that when those care needs change, that they're able to recognize them and create a new care plan that meets these changing needs. The other kind of nifty thing about the CRCs is that they did introduce in 2018 kind of a patient portal for caregivers. You know how you can go to like MyChart or whatever patient portal you have for your own self? Caregivers have this. And so you can do your assessment online and then you can help connect to resources that might fit with your needs. So that's kind of cool. I also have to mention the guide model. So we talked about how there's this kind of contradiction or uncertainty in terms of payment models that can disincentivize providing kind of this wraparound care for caregivers and the person they're assisting. The guide model is the solution that came up from the Center for Medicare and Medicaid Services. It began in 2024. It's a pilot, so it's not permanent. It's an 8-year pilot. We hope it becomes permanent, but it provides an opportunity for organizations who participate to get reimbursed and financed to support care navigation, caregiver training. There's an option for respite care for the caregiver. So that's really cool, especially because we didn't previously have a lot of billing codes and opportunities to pay for things through Medicare. And I do want to mention this is for traditional Medicare, not for Medicare Advantage plans. So I'm just going to do a like brief flash of this slide. If you go online, you can find this if you look up the guide model, but you see these two sides, this dark and dreary side. This is life without the guide model. You get a diagnosis and then you're left on your own to go find information. And then, the care kind of falls apart from there. Under guide, you get this diagnosis, and then the caregiver gets a needs assessment, the care recipient gets a needs assessment, and life is much more cheery on that side. So I won't go too far in depth, but you can see it's more about that connected care. And then I do want to mention our neighbors in Cleveland, Benjamin Rose, who are just a fantastic organization, and they have been providing evidence-based programs for caregivers for a long time. They've had for a couple years now their dementia care programs that they provide kind of a menu of evidence-based programs. So if you're an organization, you say, hey, we need a program that focuses on this. We want it evidence-based. We want to know the training needs. We want to know the licensing cost. This is the place you want to go. They recently opened up kind of a side for caregivers to search for programs nationally for those programs that can be delivered online as well as locally. So well worth a look. And then lastly, I do want to share because I am a researcher. I'm actually not recruiting. I'm in a weird phase in my research life where we have nothing we're recruiting for immediately. But I have some colleagues who are at Emory who just do some fantastic work. They're enrolling for the Can Do study. So if you do know any caregivers who might be interested in working with a great research team, they're your people.
Dr. Meyer, thank you for helping us better understand the financial realities that many caregivers and family systems are facing as patients are navigating these dementia journeys. Our next speaker, Mr. John Brown, will offer a complementary perspective by highlighting the practical realities of navigating dementia care and support services for patients, caregivers, and their family members here in Central Texas. We're pleased to welcome Mr. Brown as the owner and CEO of Oasis Senior Advisors Austin in Central Texas and the founder of Senior Industry Services. He will share with how his work helps families understand care options, connect with local resources, and make informed decisions as care needs change over time. John, thank you again for joining us today. I will turn it over to you.
Thank you. I'm so glad to be here today. If you can go ahead and go to the next slide. When we're talking to caregivers, we're talking to families, as Dr. Meyer said, there's always a split that occurs right off the bat, and that is the healthcare side and then the non-healthcare side. So when we look at CMS 2026 changes, we look at Oasis E2 for home health changes, or we look at QAPI surveys, we're moving away from a medical model that is only focused on what's going on in the hospital and now including everything that's happening after they leave a hospital, after they leave a rehab, after they leave a physician's office. And so they're gradually moving to more of a holistic approach, which is good, and I think it will improve outcomes. But right now, it is that struggle as we're moving through it. So now it's all about, the caregiver's capacity, the dementia case, the discharge, is it safe? Are they safe at home? Things like that. And so, that's really where we're going with all these changes to CMS and with Medicare. Next slide. So healthcare is increasingly being measured not just by what's happening during treatment, but what's happening when the patient returns to the community. We often see situations where the medical issue has been addressed, of course, but the caregiving, the safety, the long-term support needs to are still unresolved. And that's the whole discharge process can, be clinically complete, but yet it's still very fragile out in the community. And that's where we have to bundle all these resources together to come up with good solutions. Next slide. So, common every day we deal with this in Central Texas. Mary had pneumonia. She landed up in the hospital. She went to rehab, got a little stronger, gets home, and then things start to break apart. The daughter is exhausted from checking in on her and taking care of her. Medications are missed. The refrigerator's empty. Wandering at night, missed follow-up appointments, the family discussing memory care. It's all kind of coming together, and that's unfortunately the way it happens in real life is you've got a health event. Now we got to get serious, but then often the families feel like, okay, I've addressed the health event, but it's all the community part that kind of starts falling through the cracks. Like Dr. Meyer was saying, transportation, care coordination, who's going to come in and do the caregiving, who's going to help mom if I live out of state. Again, because her cognitive abilities had changed because of pneumonia, now we have kind of a fragile situation. Next slide. Dementia and aging, it's a progress. It's not a straight line. The whole healthcare system, it's a journey. And I think often families think that they can just kind of solve this problem in front of me, and then it creates other problems, right? So you've got to look at everything at a holistic approach. You've got to look at the finances, you've got to look at the care, you've got to look at what resources are out there, and then you have to blend it all together. And if you don't, you end up making one mistake here or one mistake there that can be, detriment all the way down your aging journey. Um, Next slide. So this kind of it gives a good kind of overview of basically you've got the healthcare system, the hospital, or maybe it's a physician's office or a rehab. And then all of a sudden you start moving down, and as you move down, it just starts going in all different directions. You've got home health, you've got home care, you've got hospice, you've got palliative care, you've got inpatient rehabs, you've got skilled nursing, you've got, going home with caregiver support, and then some go back and forth, and so that's kind of where it kind of starts to fall apart. In a hospital setting, in a physician setting, you've got CMRs, you've got ERM, you have protocols, processes, and diagnosis is occurring, but it's in a structured workflow. Once we're in the community, there's no structure. It's crisis. And most families are reacting to a crisis at that moment, like, okay, mom was wandering last night. I've got to deal with that crisis. Dad, fell again. And so that's kind of where it all kind of tips over into moving away from the health side to the non-health side. Hospital rehab physicians, they have all these processes, and the families don't. And so that's really where we have to kind of step in, kind of help them, guide them, offer them resources, offer them solutions, bring those community resources to the forefront so that they can, live life to the fullest. Next slide. So this is just an example of the medical versus the non-medical side and how the family is always in the middle. You've got the physicians, the nurses, the therapists, the social workers on the other side. You've got caregiver burnout, isolation, home safety, finances, medication, and then they're trying to blend all that together. And that's really where it gets exhausting. The healthcare system works in minutes and hours. Families make decisions on emotions. And so we really try at Oasis to help make that work, and try to explain to them that I understand you want mom to stay in her home for the rest of her life, but is it safe? Can you afford it? What does the long-term plan look like? What resources are out there that can help you? Next slide. So again, this is everything the family's trying to navigate after they leave the hospital, right? The transportation, the respite care, the adult day programs, home care, home health, hospice, AI. And while AI, I'll go back to Dr. Meyer's speech, AI is doing great things in the healthcare industry. One thing it has definitely impacted by CMS and what we're seeing is it is looking at everything as outcome based. Everything is outcome based. And so what we're seeing boots on the ground is an example, it's always been a traditional process. Somebody's in the hospital, let's say for pneumonia or a stroke or a UTI. They spend 3 overnights. They go to skilled nursing or rehab. They're there for a few, maybe 2 weeks, 3 weeks, or a month, and then they go back home. That was always the journey. Now with AI, with CMS changes and Oasis E2 and QAPI changes, we're seeing dozens and dozens of families no longer qualifying for rehab. And the reason being is cognitively, mom is not going to retain the information. And so why are we spending this exorbitant amount of money on an inpatient rehab, which is, on average about 2+ thousand a day, if she's not going to retain the information and she's really not going to get the benefit that's there? We're seeing, others besides just the cognitive piece, they're not getting approved because they have a history of emergency room visits. And so their care is not improving. And so the outcome is not going to be there. They have a history of falls. They have a history of going AMA. So you've got people that go into rehab and then all of a sudden they're there for a week and they're like, okay, I'm done. I'm ready to go home. And they're leaving early. And then 2 months, a month later, they're trying to get back in the hospital system and get back to rehab, and it's not being approved because they've left early multiple times. So all these things are kind of impacting the family on their journey. Next slide. So, yeah, so most caregivers don't realize they're in a crisis until it's already over, they're overwhelmed. The medical side can be taken care of. It's the non-medical side that always causes the pressure, the stress and the financial pressure, and sometimes it's just the way they make their decisions. We often hear families say, "Oh, we're okay, we'll figure it out." Or dad wants to stay at home, or we're not ready yet. And, that's unfortunate, but, we're all aging and everybody's doing it. And, you need the right care around you to age appropriately and maintain independence. And I think sometimes that short-sightedness, families do struggle with it because mom's just not happy today and they want to address it today. But they've got to have a long-term plan. Next slide. So, Oasis Senior Advisors of Austin and Central Texas, we've helped thousands of families in our 10 years, and we always see kind of the same thing. It's a hospitalization, it's a fall, it's wandering, it's caregivers getting burned out. There's always that tipping point when they're starting to figure out, okay, I need more help. And again, if we take a holistic approach and really have a long-term plan, they can understand that journey and it's not as stressful. Unfortunately, we live in an internet age where, we can easily Google and get an answer. But aging doesn't work that way. It's a journey, and we all have to work together for it to be successful for the senior. Next slide. So, sometimes the answer is more support at home. Sometimes it's a respite. Sometimes it's an adult day center. Sometimes it's assisted living, memory care, care homes, independent living. Sometimes it's transportation. Sometimes it's a financial situation that needs to be addressed, whether that's Medicare, Medicaid, VA. All those things come into play when the family's trying to navigate, the community support, what nonprofits are out there, what grants are out there, what churches do. So trying to put all that together to help the family kind of make it through that journey. Next slide. Um, one big misconception we see is that families are making a single decision. In reality, like I said, it's 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 stacking up interconnected decisions in the same time. So you've got the healthcare, the safety, the caregiver, the finances, the housing, the transportation, the long-term care planning, kind of all coming into one big ball. And that's where families really struggle because they're looking at, well, today I just need someone to get mom from point A to point B, but you've got to have that long-term plan. Um, this is why guidance and support is so important, discussing any specific solutions, whether that's additional support at home, again, adult day programs, respite, assisted living. You've got to have a plan and you have to know where those triggers are on that journey. Next one. Um, the more families we help, the more we realize that the problem wasn't simply a lack of resources, but it's a problem of getting them in front of the family at the right time. And so we started Senior Industry Services. It's a networking group here in Central Texas, and we're working to collaborate to help families, you know, on their journey. So that could be, educational resources, that could be, home care, home health, hospice, could be wound care. Transportation is always a biggie. Could be Medicaid specialist, it could be a VA specialist. So we're working at Senior Industry Services to bring all that together so that if they talk to one of us, we're all working together to help the family on that journey. Next slide. So, no single organization can solve dementia caregiving challenges alone. This is why collaboration like the Brain Health Community Collaborative matter. That's why THRC and their team matter. This is complicated, and there's so many different sides to it that when a family's in this crisis, again, they're making decisions on emotion. Medical teams are making their decisions based on minutes and hours. And so, we're definitely seeing faster discharges, faster decisions, and we're just trying to help the families kind of get to the right place at the right time. Next slide. So, senior industry services is we created it to strengthen the connection between families, healthcare professionals, community resources. Our mission is to educate, collaborate, and improve access to services and support systems that help older adults age safely and successfully here in Central Texas. Our goal is to make Central Texas the best place for seniors to age through education, networking, resources, and again, collaboration always leads to better outcomes. And then with Oasis Senior Advisors, our mission is simple, is to help families with senior care, make senior care decisions with confidence and compassion through a free local holistic consultation process. We help families understand their options, bridge care gaps, identify solutions that are safe, sustainable, and align with their loved ones. Oasis, it's one call, many solutions. You're not alone. We just want to help a family find what they need.